Hello, my name is Mohammed. I work in the strategy unit and I've been asked to share a few thoughts related to the issue of analytics in healthcare. The first question I'll address is why is analysis important for decision makers in healthcare? Well, in my view, the most important process in health and care is a process by which we make decisions. Because decision making is made under uncertainty in a complex adaptive system where linear cause and effect relationships are elusive. A poor decision-making process impoverishes all that follows it. Indeed, it is very hard to recover from a poor decision. We can all reflect on decisions we've seen happen recently, either in the political realm or during the pandemic. And once a poor decision is made, it really is very difficult to recover from it. An analysis, both qualitative and quantitative, can be used usefully to support decision makers and to support the decision-making process. And analysis will do so by helping to reduce the uncertainty and increase our confidence in the decision that's being made. And that's, I think, is why analysis is so important to decision makers. The second question relates to the extent to which analysis is currently well used and the extent to which the workforce is well used. Well, obviously the two questions are interrelated. In my view, analysts are usually too far removed from the core decision-making process and are mostly seen as staff who can get the numbers, which will enable others to make their decision. So this disconnect between decision makers and analysts is problematic. Consider, for example, if I was to ask someone to count the number of people in a room, but the why do I need that count, is not clear. So if I was to name different purposes, for example, I want to arrange sufficient refreshments. That's why I want to know the number of people in the room. I want to arrange adequate seating. I want to consider health and safety issues. I need to determine the number of certificates that I'm going to give out to the people in the room who are delegates on a course. So depending on the purpose, that count has a different meaning. But none of those But knowing the count of people in the room, even for all those different purposes, doesn't tell me why they're in the room. So this is why we need qualitative data. And in my experience, our analyst workforce does not lack the capability or motivation, but often lacks the opportunity to engage in a meaningful way with the problem that decision makers are trying to address. And part of that is really down to decision makers not being able to perhaps reach out to analysts. Likewise, analysts not being able to reach out into the decision-making process. So it's a disconnect that is attributable to kind of both parts of the system, as it were. The third question I'm going to have a look at is how could analysts be made better use of? Well, I think there would be several ways. One I've already alluded to, that we need to find a way for greater engagement between analysts and decision makers on the broader aims and objectives of health and care, and to get for analysts to get closer to decision makers and the decision making process. Analysts can really help to clarify the problem that's being addressed, and often analysts can help to identify and clarify core questions. Analysts can have an important role at the design stage, even before pilot studies are undertaken. For example, often people have an idea, a plan, and analysts can help to evaluate it at the design stage, which is often very meaningful, where the greatest learning will take place and the greatest number of assumptions are surfaced and identified. An analyst can help at the implementation stage. They can determine how well a particular plan is being implemented in practice, and they can help at the summative stage to help determine the extent to which something has worked in practice. So problem formulation, design stage evaluation, implementation, and summative evaluation, these are all stages in which our analysts can help us. The next question is, what needs to change to make kind of these things happen? This is a bit of a tougher question, really, but there are a few suggestions, but it is a tough gig. The first thing I'd say is that there needs to be a change of behaviour on the part of decision makers to recognise that they must work harder to improve the decision-making process. And in order to help decision makers, I think there needs to be a training and development offer for decision makers. We also need to call out poor decision-making processes. And I'm careful about the use of the word process here, not decision maker. People are well-intentioned in trying to do the right thing. So it's not a failure of individuals, but it's a failure of a process. So some element of calling out poor decision-making processes, but also amplifying good decision-making processes. So a kind of shaming and faming, really, of good practices and poor practices, good processes and poor processes. And I think there might need to be some really crude intervention, something that says, for example, all projects which have more than £1 million attached to them would require design stage evaluation independently by analysts, for example. I think a senior board level appointment, head of analytics or head of decision making, head of analytics, and a leadership development program to support analysts to rise to board level positions and senior positions, because analysts often have good technical training, but lack the leadership development support that they need to take on senior roles. The profession of analysts needs to be professionalised, and there's good efforts going on through the Association for Professional Healthcare Analysts, for example. And I think the NHS needs to recognise that it's a very complex, the health and care system is a very complex structure, and it needs a decision support unit which can support decision makers and analysts, both through individual projects, through training, development and learning and sharing, especially using open source data science tools. And I'm pleased to say, really, that the strategy unit are coordinating the development of a network of decision support units for the health and care system, which will be launched in September. And I think and a key part of its function is to provide the training and development and leadership support for analysts and also for decision makers to try and find this common ground of finding a way to improve the quality of our decision making. Thank you very much.